Hello everyone, I'm Libby Ruffhead, Chair of the International Society to Improve Use of Medicines. Today we celebrate International Rational Use of Medicines Day, but more importantly, we celebrate you and we thank you for all the efforts you put in to improve use of medicines. We know it contributes to improving the lives of many. Enjoy the day.
Hi, I'm Dr. P. Ravishankar, currently working at IMU University in Malaysia. Previously at KIST Medical College in Lalitpur, Nepal, I and my colleagues had introduced several initiatives for undergraduate medical students to improve their understanding of rational use of medicines, including P-drug selection, patient criteria, patient counseling, and pharmaceutical promotion. These are being continued by Dr. Jha and her colleagues presently. Thank you.
Hi, I'm Tien, a research fellow at Adelaide University and the Safety and Quality Lead Pharmacist at SA Pharmacy, SA Health. To me, rational use of medicines means using the right medicine at the right dose for the right reason and using it with care. Because every prescription, every medication counts. Making sure we prescribe with purpose, use with care for a healthy and informed future.
Muhammad Ogi from Nigeria, a lecturer at the Federal University Benin Kebbi. I am committed to improving rational drug use through teaching responsible drug use and the safe principle of drug prescribing. I have trained many healthcare workers in the country on rational drug use, and I have supported many Nigerian hospitals to develop and implement antibiotic stewardship programs to help reduce the burden of antimicrobial resistance. Thank you so much, and I wish you happy International Day for Rational Medicine.
Hello, I am Dr. Eob Gabriel-Johannes, a pharmacist and researcher based in Adelaide University in Australia. Rational use of medicines depends on having robust evidence both on the benefits and harms of medicines. My current research focuses on pharmacovigilance with the aim of increasing the quantity and quality of adverse drug events reported to medicine regulators. This helps us identify medicine safety signals earlier and support safer prescribing and better outcomes for patients. Thank you.
Hello, dear friends. My name is Natalia Chebotarenko. I'm a president of CARSAM, Coalition on Rational and Safe Use of Medicines, working mainly in Russian-speaking countries. This year, altogether, we celebrate the second time of the International Day on Rational Use of Medicines. CARSAM continues to publish independent drug bulletin. We continue to educate clinical pharmacologists and clinical pharmacists, and we expand our program Children and Medicines, now joined by Yakutia.
Hello, I am Subhas Mandal, a registered pharmacist from India. For the past 40 years, we have been working to promote the rational use of medicines through advocacy among communities, healthcare providers, and policymakers. Our efforts also include a range of complementary strategies such as public awareness campaign, stakeholders engagement, policy advocacy, and educational initiatives. One example of the impact of our advocacy relates to the widespread availability of irrational fixed dose combination medicines in the Indian market. We identified that many of those products contributed to the irrational use of medicines and posed potential risk to the people's health. Through sustained advocacy with the Ministry of Health, we highlighted the concern and supported evidence-based policy action. Recently, the ministry prohibited the manufacture, sale, and use of 16 categories of such FDC products. We believe that promoting the rational use of medicines is essential for improving patient safety, enhancing the quality of health care, and advancing universal health coverage.
Hello, I'm Libby Ruffhead. For many years, I ran a program to improve use of medicines amongst the Australian veteran community. One of the important learnings of this program was to involve everybody. We had a veteran reference group so we could understand the needs of veterans themselves. We had a practitioner reference group so our program met the needs of busy practitioners. We had a clinical reference group who helped us write our materials. And we had a national representative body of both health professional organisations and consumer groups so that their members knew the importance of the materials we were producing. The importance of this activity was that it enabled us to build trust, that our program met the needs of the people we were writing for, the materials were culturally appropriate, but most of all, that we ended up with shared ownership of the program, which contributed to its true success. Thank you.